Hi, namaskar dear students. So currently we are focusing on the anti-hypertensive medications, and so far we have discussed various different medications that use for the management of hypertension. But today we are going to discuss about the anti-hypertensive medications that is considered as a vasodilatory medications. Mainly these class of medications are used for the refractive hypertension, or this medication used for the hypertension emergency. Okay, so without delay, let's jump into the vasodilators, and we are going to focus on various different medications. Okay, so in today's class we are going to focus on vasodilators. Okay, vasodilators and diazoxide, hydralazine, minoxidil, and we focus on sodium nitroprusides. So these are the class of medications that we are going to focus on today's class. Diazoxide, hydralazine, minoxidil, and sodium nitroprusides. So you in examination you can expect different type of questions from these medications. Okay, and all the important points are going to be covered in today's class. Okay, first of all, name itself indicating the vasodilators. So these medication have a potential to dilate the blood vessels. So now broadly we have to divide the blood vessels in two groups. One is artery and other one is vein. Okay, so this is the artery and vein. Arteries are connected with the heart, so the pressure is from the heart to the arteries, and veins is carrying blood towards the heart. So this is very important physiology. Okay, so like for example, if we are going to dilate the arteries, so artery dilations reduce the pressure on your heart. That means this dilation of arteries may lead to the reflective tachycardia. Okay, that's the reflection, and due to that reflection increase the sympathetic tone, and also that reduce the significant blood pressure that can increase the fluid retention. Okay, so these are the two important physiological changes happen with the artery dilation. This artery dilation can increase the sympathetic tone and also increase the fluid retention. Why? Because the body is in a compensatory status, and in this compensatory status they try to understand and maintain the normal blood pressure. Okay, so this is very important physiology you have to keep in mind while you are learning this concept. When we are dilating the veins, okay, so mainly venodilations increase the holding at the peripheral level, and that reduce the preload. Okay, so the more fluid is retained in the peripheral system and less fluid reach to the heart, so that minimize the pressure on the heart wall. Okay, so that's the venodilation. So when we are talking about vasodilatory medications, broadly we can divide the medications into artery and vein dilation. So far you have understood the different physiology that involve in artery and vein. Okay, perfect. So vasodilators are a potent antihypertensive. याद रखिए, this is the potent antihypertensive. These medications are not used in a common way. This is reserved for refractory hypertension. That means other medications are not giving enough responses. In that situation, we can use such kind of medications. That is the one thing. And the second thing is this medication used for hypertensive emergency. Okay, so these are the two special kind of things in where we can use the vasodilators. And some medication have a specific indications. Okay, specific indications. Okay. Now, the most important point is hypertensive emergency. Make sure avoid precipitous BP reduction. That means we must have to be careful about hypertensive emergency. We don't have to give medication in such a high dose and reduce the blood pressure significantly in shortest possible time, because if we are going to do that kind of activities, reduce the significant blood pressure in a shortest possible time, the body is not going to accept and adopt this change, and that can lead to the myocardial infarction or stroke. Okay, that is very, very important. That's why the hypertensive emergency management, we have to be very careful. We don't have to reduce the blood pressure significantly in shortest possible time. Gradually we have to reduce the blood pressure so the body can adopt the new pressure and we can minimize the complications. And during the hypertensive emergency, we have to continuously BP monitoring is recommended. Okay, so vasodilatory medications, total we have 4 different medications in this group: diazoxide, hydralazine, minoxidil, and sodium nitroprusides. But diazoxide, hydralazine, and minoxidil, these 3 medications are mainly focused on the arterial vasodilators. These 3 medications are main arterial vasodilation with the minimum effect on the venous smooth muscles. That is very important to remember. Okay, their action leads to reflex sympathetic stimulation. That means the artery dilation is causing the reflection to the sympathetic, and that can cause the tachycardia as well as the fluid retention. Tachycardia and the fluid retention. These are the side effects associated with this type of medications. To control such kind of side effects, normally this medication is combined with beta blockers to minimize this reflective stimulations, and diuretics for fluid retention. Okay, so whatever fluid has been retained, we can give diuretics to flush out that fluid, and the beta blockers that control the tachycardia. Okay, so if you are going to understand the physiology in a practical way, you are ready to understand this concept. Okay, reflective tachycardia controlled by the beta blockers, and the fluid retention controlled by the diuretics. So if you are going to get the questions in your examination, the vasodilators, why vasodilators combined with the beta blockers and diuretics, which of the following statements is making sense? So you should have that level of understanding. Now, the sodium nitroprusside. Sodium nitroprusside is a non-selective vasodilators that dilate both artery and veins. Okay, so these are the 4 different medications, have a different level of mechanism of actions. Perfect. Okay, let's jump into the comparative information like diazoxide. In your examination, diazoxide has 3 key points you must have to remember. 3 key points you must have to remember. One is diazoxide used for hypertensive emergency. Which dosage form? It's in IV. You have 2 different IV forms used. One is intermittent or in an infusion form. These 2 kind of administration is possible in hypertensive emergency. Second most important thing is diazoxide can cause hyperglycemia. This can cause hyperglycemia. Okay, that means you can consider this as a side effect, but also you can consider in a different way. If the patient is suffering from a severe hypoglycemia, so we can give a diazoxide. But here, trick is to treat intractable hypoglycemia with the oral diazoxide. This is a very important question you can expect in your examination. Hypoglycemia, which dosage form of diazoxide is used for treating the intractable hypoglycemia? That is the oral. But in emergency or in hypertension, chronic hypertension, we cannot use the oral dosage form. Okay, not use oral for the chronic hypertension due to poor tolerance. So these are the 3 points we have to keep in mind: dosage form and user cases. hypertensive emergency, chronic hypertension, and for hypoglycemia. These are the three different user cases of the diazoxide, but the different doses form we can use. Perfect. Okay, hydralazine. Another important point is hydralazine. SLE is the side effect uniquely associated with the hydralazine. So many a times you can get the questions like hydralazine can cause systemic lupus erythematosus. This is the side effects. Hydralazine is administered IV in emergency situation. In pregnancy associated with the maternal and perinatal risk. Okay, can be used orally in low dose for the refractory hypertension. This is used for the orally, but for non-responsive hypertension. This is very important point. Hydralazine in heart failure patients. In heart failure patients, normally we are using the ACE inhibitors, but if the patient is not able to tolerate ACE inhibitors or ARBs, in that situation we can give hydralazine with nitrates. Okay, so look carefully. Hydralazine is dilating arteries and the nitrates dilate the veins. Okay, so the vein dilation is reducing a preload and artery dilation reduce the afterload. So afterload and preload reduction is significantly protect the heart, and that's why the heart failure patients can get the benefits with this combination. So hydralazine with nitrates, this combination is used for the hypertension patients, those who are unable to take the ACE inhibitors or ARBs. This is very important to understand. Combined with isosorbate dinitrate, reduce the mortality, but the inferior to the ACE inhibitors. So first we have to select the ACE inhibitors, but if the patient is not tolerating ACE inhibitors, then we should use the alternative medications in that situation. Perfect. So the hydralazine is important medication to remember. Minoxidil. Nowadays minoxidil is not used very frequently because this is not available in IV form. Give orally for the severe refractory hypertension, but the side effect associated is hypertrichosis. Hypertrichosis, that means that can cause the hirsutism or increase the hair growth. Okay, that's why normal situation this medication is not preferred in women because that increase the hair growth. But nowadays the minoxidil is mainly used for topical formulations in a solution form for the male pattern baldness. That means the minoxidil is nowadays used for male pattern baldness, more common compared to the hypertension management. Sodium nitroprusides, this is very important. 2-3 points you have to remember. Administered via IV infusion in emergency situation. This is a short acting, very short acting. In minutes you can get the response. Allow titration to avoid hypotension. That means this is a very short acting. Gradually and slowly we can administer the medications to reach at the targeted blood pressure and avoid the hypotension. But make sure the longer duration, if we are using the sodium nitroprusides, that can increase the thiocyanate concentration in the body and that can cause a toxicity. Okay, so cyanide-like toxicity is the problem associated with the nitroprusides, and that's why maximum use of nitroprusside should not be more than 72 hours. Okay, so the limit use of nitroprusside less than 72 hours. This is our goal. So these are the most commonly used 4 different medications, and now the another class of medications that we have to focus is centrally acting antihypertensive medication. Centrally acting. The another, like earlier we had discussed, was the medications that considers the vasodilatory medications. Now we focus on the centrally acting antihypertensive medications. Okay, now before we start discussing this point, we have to focus on the physiology. Okay, this is the physiology. For example, this is your sympathetic nerve, This is a noradrenaline. This in a vesicles. Now this exocytosis process, this vesicle is getting squeezed out and this noradrenaline is released. This noradrenaline is bind to this receptor and produce the effect. And we know what are the effect of sympathetic, okay? So this effect is produced in this way. But how this control is happen, because this noradrenaline is normally acting here. There is another receptor that is called alpha 2 receptor. This is alpha 2 receptor is considered as a feedback mechanism receptor. This noradrenaline, the enough concentration of this noradrenaline is bind to alpha 2 receptor and that produce the effect. That means this alpha 2 agonist that produce the effect and they give signal to the nerve terminals. We have enough concentration of noradrenaline and we don't need any more. Okay, so this alpha 2 agonist that is in a central compartment. This is a central area, and alpha 2 agonist is a negative feedback mechanism receptor and they are stop releasing noradrenaline. If the noradrenaline is not released, that means the beta 1 receptor mediated cardiac contraction is minimized. Peripheral alpha 1 receptor mediated vasoconstriction is minimized. That means the patient is getting benefits in control of blood pressures. But beta 2 receptor mediated peripheral blood vessels dilation also impaired. Okay, so in that situation, Raynaud condition patients should be avoided with such kind of medications. We can discuss that in a later part. But centrally acting medications like clonidine has a mechanism on alpha 2 receptor agonist. Okay, so make sure majority of the students are getting confused between two medications. One is alpha 1 antagonist. Alpha 1 antagonist are used as antihypertensive and alpha 2 agonist used as antihypertensive. Please make sure you don't have to confuse with the alpha 2 antagonist. Alpha 2 antagonist is not used for hypertension. Alpha 2 agonist used for hypertension and alpha 1 antagonist used for hypertension. Perfect. So clonidine, methyl-dopa and moxonidine, these medications also we have to learn. Okay, the mode of action, these are centrally acting alpha 2 adrenoreceptor agonist. They reduce, like methyl-dopa is converted into the different kind of catecholamine and that also stimulate the receptor alpha 2 and that stop. That's a false neurotransmitter produced and that stimulate this receptor and stop the surge of sympathetic tone. Okay, these drugs centrally acting alpha 2 receptor agonist, the reduce blood pressure by decreasing sympathetic tone. Perfect. Effective. These medications are effective but not the first line agent due to poor tolerability and lack of cardiovascular outcome data, because this is a broad spectrum effect, that effect on central nervous system and the widespread side effects are associated with this kind of medication. So we are not consider this medication as a first line treatment in normal individuals. Okay, like methyl-dopa can consider for different situations as a choice of drug. Clonidine used for so many different purposes. We are going to discuss those in later on. Perfect. Clonidine. Sudden withdrawal may cause a hypertensive crisis. Perfect. Sudden withdrawal. What happens if we are withdraw this medication suddenly? So that can create the positive feedback mechanism and significant high amount of noradrenaline can release, and due to that significant noradrenaline release that can cause a rebound hypertension or hypertensive crisis. That kind of problem could be possible with the sudden withdrawal of clonidine. So clonidine need to be withdrawn in a gradual form. Methyl dopa, preferred in pregnancy. Preferred in pregnancy. So methyl dopa can consider as a good choice of medication for the pregnant woman, but the CNS and hepatic adverse effect are associated, so we have to closely monitor those kind of effect. Moxonidine, the large trial control release moxonidine in heart failure was stopped due to excessive death. When the clinical trials were going on, maximum patients were died use of moxonidine, and that's why that medication is avoided in the patient with hypertension and heart failure. This kind of combinations normally moxonidine should avoid, because in heart failure patients that increase the risk of death. Okay, so perfect. We have discussed pretty much all the key points related to vasodilators, and also we have discussed about some of the centrally acting antihypertensive medications. Thank you very much for joining today's class, and see you in the next class. Have a great time. Bye bye. Take care.